Hey guys, welcome back to my channel. Today's video is going to be on blood types explained. If you guys are interested in this video, let's get into the nitty gritty. So let's say you have a patient and the doctor has ordered for blood to be administered to this patient. So you're going to need to make sure that this patient, first of all, has a blood transfusion consent or refusal. If they're a Jehovah's Witness or for some other reason that they don't want to receive blood, you need to make sure that that's covered. And then also you need to have type and cross-match sent to your lab. So what it is they take a sample of blood and they determine what's the blood type of the patient and what reactions occur with the donor blood that's going to be administered for that particular patient. So once the labs are sent to the blood bank and they tell you the patient's blood type, they will send you the blood, in an orderly fashion. But let's go into detail about what patients can receive what and what a specific blood type looks like. And it's in a more explained detail, and I'm going to go over to my iPad for you to understand that a little bit. And then I'll come back.
So first things first, I'm going to go over what each different blood type looks like. First, I'm going to go over A. So A, if you notice underneath is all these little blue things, it's a red blood cell. So it's just a plain red blood cell. And then on the surface, it has these little blue triangles. I'm going to call those the A surface antigen. So these red blood cells have all these little A surface antigens, but in the blood, and then in the plasma, they have anti-B antibodies. So this way, if some other foreign blood gets into the body, these will attack. They'll be used to attack the blood cells. Then B it's a similar structure, but it has the B surface antigen on the outside. And then it has the anti-A antibody in the plasma. So you notice these are meant to attack here, and these are meant to attack there. So you can't give somebody with an A blood type B blood or anything like that. But I'm going to get into who can receive and who can donate in the next slide. With the AB blood type, if you notice, it's similar to A and B, but it has both A surface antigen and B surface antigen, but it has no antibodies in the plasma. So this is awesome because then you can receive blood from both A and B without having a problem where it reacts with the blood based on the surface antigen and the antibodies in the plasma. And then O has no surface antigen. So it's just a plain little red blood cell, but it has anti-A antibody and anti-B antibody in the blood plasma. So this makes it then the universal donor. I'm going to get into that right now on the next slide. Okay, so A, based on the way that the structures were, A can donate to A, and A can donate to AB. Because remember, AB doesn't have any antibodies in the plasma. Then B can donate to B, obviously because they're the same, and it could also donate to AB. Then AB can donate to AB, obviously because it's the same, and that's it. And then O can donate to O, because it's the same. It can donate to AB, it can donate to B, and it could donate to A. So if you look at it, this here indicates that you can give this blood type to any recipient. So that's why it's important to have O in the blood bank, especially for trauma cases. And then if you look right here, AB is receiving from A, B, and O, so that's why they call that the universal recipient. So universal. Ooh. Recipient, and this is the universal donor. All right, so that's just going based on the structure of the blood that I explained here, the surface antigens on the blood. Okay, but now let's get into RH. So the RH factor is also another surface antigen, but if it's present, it means it's RH positive, and if it's absent, it's RH negative. So if you see here, the RH on this blood type means it can receive both positive and negative Rh factor because the negative has no surface antigens. There's literally nothing on the surface. So, but then the Rh negative can only receive Rh negative blood. Otherwise, you're going to have a blood transfusion reaction. Now, now we're going to get into detail about the 8 different blood types. So this is what we went over about the A surface antigen, and then now we're going into the surface antigen plus the Rh factor. So here, you're going to see that this is with Rh and this is without. So this means that it's A negative and this is A positive. Now in the same sense over here on the B side, you see that it has the Rh here, but it doesn't have it there. So this is B positive and this is B negative. And then for AB, you have Rh on this one, no Rh on that one. So this is AB positive and AB negative. Now for the O's, you see the Rh and no Rh. This is O positive and O negative. So now we went over what it is to be the universal recipient right here and the universal donor. So the universal donor means that it has no surface antigens, but it has anti-A and anti-B in the blood plasma. So that means you can't just give any blood to this person. You have to give it, either O positive or negative, because now if you incorporate the fact that there could be the Rh positive factor, you can only receive then O negative blood or O positive blood, okay? Because you cannot give somebody with Rh positive blood to somebody that is O negative. Make sense? So that limits you in terms of what blood you can receive. And then for AB, the same applies with the Rh factor. So if there's Rh positive all over this, then the person who is AB negative is now eliminated. You cannot give them AB positive blood because it has a Rh surface antigen all around it. So it would have a blood transfusion reaction. Make sense? So this is the universal donor right here. And this is the universal recipient right here. Okay, because you can receive A, you can receive B, wow, that's ugly B, A, B, and O, and you can receive both Rh positive and Rh negative for this one. And then for here, you can donate to any blood type because there is no surface antigens and that way it can be given to anybody and no Rh sensitivity. Now, let's go on to the quiz. So who is the universal donor? I just covered that in the last slide. This is the one that can be given to all the blood types. So we said that is O negative. And then the universal recipient is AB positive because you can receive all the blood types plus all the Rh sensitivities. Okay, now this is a true and false. Rh negative blood types can receive both Rh positive and Rh negative blood. True or false? So we went over the fact that if it's negative, it cannot receive Rh positive blood because you'll have a blood transfusion reaction. So this is false. A negative can receive blood from which blood types? So I'm going to refer back to the slide. So A can receive from A, and it can receive from O. Okay, but the quiz says A negative, so you can receive from A negative or O negative. You cannot receive any Rh blood cannot be given. Okay. Now, number 5. O positive can donate blood to which blood types? So we said the universal donor was O negative. So O positive, it can be donated to all the blood types in essence, but only the Rh positive causes it to be not universal. So it can be given to A positive, it can be given to B positive, it can be given to AB positive, and also itself. Okay? So that's that. I'm going to go back to the video.
So that's pretty much it for this video. The iPad was just so you can have a visual understanding of what the blood type is and what you're experiencing in your practice. If you have any other questions regarding blood type and RH sensitivity for your patient or for your practice or for your NCLEX or whatever it is, just comment down below. If you like this video, give it a thumbs up and please subscribe if you haven't already. I'll catch you guys in my next video. Bye!